Hi everyone, Dr. Star Ramson here. I'd like to talk to you about a cytokine storm. A cytokine storm is an immune system response that results in a massive amount of inflammation in the tissue responding to the infection. In regards to this occurring in the lung tissue of patients infected with the SARS-CoV-2 virus, imagine the delicate sacs of your lungs where gas exchange is occurring, filled with fluid and free radicals, with cells that line these sacs dying. You can imagine how this would interfere with gas exchange. And this is the development of acute respiratory distress syndrome that is an end-stage concern in the SARS-CoV-2 infection. Acute respiratory distress syndrome is a medical emergency where patients require hospitalization and treatment with immune suppressant drugs, steroids, and ventilation. In a paper reported in the Annals of Intensive Care in 2019, researchers looked at 4 different age groups affected by acute respiratory distress syndrome. They were trying to differentiate some of the differences between the age groups so that they could understand what are the predisposing factors to developing this condition. They compared levels of the enzyme ACE2 in these age groups, as well as inflammatory mediators. If you recall, ACE2 is an important receptor for entry of the SARS-CoV-2 virus into our lung cells. They did not find any differences between the age groups in levels of this receptor. They did, however, find much higher levels of inflammatory mediators in older groups who are suffering from this condition compared to the young populations. Of course, this is just one study, but it is suggesting that it is an over-exaggerated immune response or a lack of proper antioxidant and anti-inflammatory control that is leading to acute respiratory distress syndrome in older populations. Many of the cases of SARS-CoV-2 infection will be a mild case of flu-like symptoms where patients are advised to take care at home. I am asking the question, in these cases of patients taking care in their homes, is there anything that we can do to support a modulation of their inflammatory and antioxidant capacity? We don't know. Unfortunately, there are no studies in humans or even animals or in test tubes on the use of agents that can prevent the development of acute respiratory distress syndrome. Much more study is needed on this. That being said, there are some agents that have been studied in acute respiratory distress syndrome that could be considered in mild cases of flu-like symptoms in patients taking care at home. Before I get started, I want to acknowledge that there is absolutely nothing that takes the place of hospital interventions if those are indicated. If you are having flu-like symptoms, call your doctor immediately. Get the testing and the treatment that you need. But if you have been advised to watch and wait and just allow your immune system to take care of this virus, let's ask the question, are there things we can do to support your antioxidant systems? Melatonin. Melatonin, you may be familiar with, is a hormone that regulates our sleep cycle. One thing about melatonin you may not know is that it is also an antioxidant. Melatonin has been studied both in animals and in humans in acute respiratory distress syndrome and has shown promise for down-regulating inflammatory mediators in this condition. We use melatonin in cancer as an antioxidant, and we use robust doses of 20 milligrams in this condition. Resveratrol. Resveratrol is a polyphenol nutrient found in the skins of red grapes and in the Japanese knotweed plant. Resveratrol has been studied in the MERS-CoV virus in a test tube. And in this study, resveratrol was found to downregulate viral replication, to downregulate NF-kappa beta, a potent inflammatory mediator, and to reduce cell death of viral infected cells. This has some promise in acute respiratory distress syndrome. Of course, this is not the same virus as the SARS-CoV-2 virus, but it is also a coronavirus. We use resveratrol in inflammatory conditions such as tick-borne disease or mold toxicity as a cell protectant. In these conditions, we give doses of 200 milligrams 2 to 3 times a day. Nutrition. Nutrition is the foundation of providing the body with what it needs. And we have so many powerful anti-inflammatory and antioxidant foods at our fingertips. I recommend to all my patients to consume 3 cups of vegetables per day from 3 colors minimum. It is these antioxidant polyphenol pigments that support our body's anti-inflammatory capacity. There are many wonderful anti-inflammatory foods that you can integrate into your diet besides fresh fruits and vegetables. Fresh herbs, ginger, turmeric, all of these add flavor and interesting complexity to our food, as well as this potent anti-inflammatory action. Thank you so much for listening to this video. Be well.